give this talk after spending the morning at the State House in Boston, where I was meeting with a number of senatorial aides with regard to a licensure effort in the state of Massachusetts to license naturopathic doctors here. So one hat to the next. I would love to just open with this this quotation here that you can read in front of you. The practice of medicine is an art, not a trade, not a business, it's a calling. And I believe that that's so true for many of the people in naturopathic medicine, that there is much more to it than just the practice of medicine. There is a lot having to do with the head and the heart. We often talk about the mind of a doctor and the heart of a healer, and that is certainly how, in one of the ways that I have been drawn to naturopathic medicine. I've been in practice for the last 30 years, so I feel I've spent really most of my adult life in and around naturopathic medicine philosophy and naturopathic medicine practice. And I find it to be just a wonderful career with amazing people in the profession, and something that has given me the opportunity to meet with patients of all stripes, with all manner of concerns, and to really offer them a kind of approach to medicine and healing that they can't find anywhere. It's not just available anywhere they would look. They have to really be seeking this out. And it's been a terrific career, and a lot of very interesting, very fun, very stimulating and challenging, and always something new. The art of naturopathic medicine, which I really want to be speaking about today, it's the application of our medicine in ways that are effective not only for the patient, but also compelling and sustainable for the doctor. And I know now many of my medical doctor colleagues and friends who are experiencing quite a bit of burnout. The nature of the medical practice, there's quite a bit of burnout. I would love to see naturopathic doctors not go in that same direction. And so I'm going to be touching today upon some of the things that I think are sort of essential to not burning out and to staying upbeat, positive, and healthy during a career as a naturopathic doctor. And our work also should be offering us opportunities for our own growth and our own healing, and provide us for a chance to express our smarts and our creative abilities, our empathy and our love. And I think that kind of work is always compelling and worthwhile. Joanne, I'm wondering if you might be able to move the control panel off of the slide stack. I don't seem to be able to move it. If you can, that would be helpful. Thank you.
I think that is on your screen, and you just use the little orange arrow and click it.
Yeah, I usually am able to do that. I don't seem to be able to get to that. In any case, I will keep trying to hit that orange button to delete that. So in the art of naturopathic medicine, we're talking about caring for patients in our care, and we're talking about being able to give each of our patients full attention, not to be distracted by other things in our own lives, and to be able to cultivate and be focused on cultivating good bedside manner with each of our patients. We're also working to create individualized plans that speak to the patient before us, not just to the diagnosis. I think that's essential. And we're trying to help every patient toward the best possible outcome for their particular problem through educating them and coming up with a plan of action and changes to lifestyle, diet, exercise, the addition of mindfulness, meditation, and other such approaches that can best address and help them with whatever their complaints are. And I think that we are working as partners with our patients to come up with plans that are not only good for them, but are also doable and sustainable, which is an important component. The purpose of our training is to teach the knowledge and skills related to diagnosis and treatment of illness. So I know some of you on the call are thinking about naturopathic medical school, and My husband, Paul Hursty, and I have had the great honor and privilege of teaching at most of the naturopathic schools in North America. And I can say that the kind of students that are drawn to the profession, the kind of people that come into the field are just amazingly intelligent and wide thinking, and really have come to naturopathic school with hearts filled with the right kind of stuff that I think it takes to become a good doctor and a good naturopathic doctor. And if they get to the school, and those of us who've been through the naturopathic medical education, there are lots of opportunities for developing those skills and learning that body of knowledge. I know for me it was just a fascinating education, learning about how the body functions in normal. That's mostly done in the first year through anatomy, physiology, biochemistry. And in the second year, learning a lot about how things can go wrong and how to determine what's gone wrong and how to call it through our physical and clinical diagnosis classes, our x-ray diagnosis, laboratory diagnosis, etc. Of course, we are also going to then be learning our natural medicine approaches through diet and nutrition, through botanical medicine, for some people through acupuncture, etc., which we then apply to the information we've learned about how the person has become ill and how their illnesses are manifesting. So one of the things that we are emphasizing in naturopathic medical education is to have our students really develop the parts of their mind that know how to ask good questions and to seek appropriate and relevant answers. It's not enough to just have a lot of data upstairs. We have to be able to apply it appropriately to the patient before us. And we want to be sure that the naturopathic medical education also upholds and maintains the aspects related to the heart and the spirit of ourselves as physicians and as practitioners, in terms of our posture toward our patients, to stay open toward our patients, to not be hardened off in any ways. And I think all of these things are worthy to talk about, because when you bring them out into the open and you speak about them, then it becomes more real, and people can discuss and talk about how some of these things could be challenging. So it's not just about the information and the data, it's also about the posture and the energy that we bring to our patients or to the other kinds of work that some naturopathic doctors do in the field. We have at the very core of our profession a beautiful naturopathic philosophy, and everything else I've mentioned is basically laid upon the naturopathic philosophical tenets. The 6 of those principles, I can just zip through them. I really do know them in my sleep. First, like all doctors, do no harm. The second is the healing power of nature, where we're trusting in the patient's inherent wisdom and capacity to heal. And we're employing the healing power from our medicines, from our natural medicines. The third is to always be looking to identify and treat the cause. We want to look beyond just simply the symptoms to try to determine and address underlying causes. We see ourselves, number 4, as teachers, educating our patients along the way in the steps to both attaining and maintaining health. And then we are always looking, in step number 5 here, to treat the patient as a whole person, to understand them as an integrated being with physical, emotional, spiritual, and cognitive dimensions. We're not just a walking inflamed elbow or a walking inflamed or irritated gut. We are whole people, and I think our patients really, one of the things they love about coming to naturopathic doctor is that this is such a central point for us. We are also very interested in the concept of preventive medicine, emphasizing overall health and wellness, taking those preventive measures as very important. We have a therapeutic order. I'm not going to go through this in a lot of detail today, but I'll leave it, it'll be up there for you to go back and look at, where we're starting at the very bottom. You have to be sure that people have the basic needs covered, and then we sort of work our way up the top of this. And the reason that this is important is this enables us to understand if our patients are getting better. As patients get better in general, they tend to move up. We can encourage them along the way, the therapeutic order. But when we fall away from our philosophy, then we can run into some problems. And many of the tools that we have in medicine and in naturopathic medicine are more mechanistic than our beautiful philosophy. and that can be problematic. So it's important as we go about our training and when we're done and out in practice that we are able to learn new modalities and consider new approaches and consider if they fit within our own understanding and the application of our philosophy. And I always say to my students that, you do not have to adopt every approach that you are exposed to or you read about or you see on the internet or a patient asks you about. But you should be comfortable with everything that you do use or recommend in your work. And I think a lot of the legislative efforts in naturopathic medicine, one of the things that's always described there is continuing education requirements for naturopathic doctors. And I think continuing education is central to our staying up on new advances and also just keeping our own skills honed in whichever parts of naturopathic medicine we are working in or specializing in. So I feel that we each do our best work and we excel at understanding our patients and being able to offer them the most naturopathic medicine can when we're able to create a space for their stories to unfold and to create a supportive and loving environment for that to happen. So for me, what that means is not having my computer open, at least in the first parts of my time with the patient, not looking at my phone, sitting down where I am sitting. I don't like to have a desk between myself and my patient. I sort of sit to the side of my desk so that there's nothing between us. And I think being a good listener and asking good questions and being patient. Sometimes when people arrive to my office, they're not familiar with the kind of information that's going to be necessary for my plan development for them and my assessment of them. So they may not have ready answers or they may not have ever thought about the kind of things that I've asked them about. So being patient and understanding that patients come along in time as the more you work with them, the more they understand the kind of information that's going to be important and relevant for you, and that can be helpful when we go forward with patients. So we're always dedicated, like all doctors, to finding answers, and we are trying to apply everything that we know in a logic and appropriate order, which sounds nice and sounds good and sounds easy. It's just a very small handful of words there. But what happens, especially as we start to treat patients that have overlapping diagnoses, who've been sick for many years, or who have chronic disease, or have imbalances in diagnoses across the physical, psychological, emotional, cognitive spheres, then the information gathered can be very overwhelming. There can be a lot of it. It can be coming at you rapid fire. There can be paperwork and lab results and verbal descriptions. And this can be very overwhelming, especially for a newer or younger doctor. So I always encourage my students to have a way of organizing information as it's coming to you and yourself not getting overwhelmed. And a lot of that has to do with not trying to do everything at the first visit. So maybe you have to see a patient 2 or 3 times to get the whole story and to develop and come up with a whole plan. We can't always do everything in an hour or an hour and a half initial visit. And we are working to create recommendation plans that work for our patients' complaints, that are actually useful and helpful, but that are also something that patients can do over a long period of time, as many patients will need that kind of time to get to a healthier place.
Amy, this is Joanne. This is
yeah.
Joanne really quick.
Yes.
There's some background noise. I'm not sure if there's something in your room that's making some kind of clanking noise or papers or what have you.
Okay. Background noise that they can hear. Not seeing anything too noisy. Okay. So I get a little closer to my computer. I'm just sitting in a room by myself here, so.
I wonder if maybe the microphone is hitting your hair?
That might be. Let me get my hair back. Put it up and back. Okay. Gotta get the hair out of the way. Okay.
Thank you. Sorry to interrupt.
You bet. No problem. I think for naturopathic doctors in the field, it's very important that we seek support when we need it, that you're never in this career or this profession by yourself. The internet, I think, has been very helpful with that, with different listservs and and whatnot that naturopathic doctors can become part of, can get information or support with a difficult case, for instance, or just, there's lots of challenges that can come up in this profession, of course. I think it's also important that we model healthy living. I talk about this a lot with my students. It's not enough to be able to know what's good for your patients and tell them what they need to do. You need to be basically as healthy as you can be. And if that amount of health and vibrancy is going to be different for everybody because we have different genetic inheritances and different environmental exposures. But we do aim to, and I encourage my students and other naturopathic doctors to really aim to walk the walk. If you're going to be recommending your patients exercise an hour a day, you exercise an hour a day, if appropriate for you. That kind of thing. I once had a patient who was a landscape designer, and I had the opportunity to visit her in her home, and I was sort of blown away by her beautiful, beautiful garden. And she said to me, Amy, if I didn't have a beautiful garden, like who would hire me as a landscape designer? It's kind of the same thing. So I think there's something to be said for putting ourselves first. And for those who are in naturopathic school or heading that way, I would say one of the hardest times to do that is during the education, because there's so much in terms of the number of hours required in the classroom and in the clinics that it can be very difficult to maintain a healthy lifestyle during school. But the schools are aware of this, and they're, I think, like medical schools need to be aware of this as well. They are doing more and more to make that a priority so that students can maintain and take care of themselves and in some cases their families as well. So how does a person move from the more mechanical aspects of applying knowledge into becoming the creative and competent practitioner in the art of naturopathic medicine? Of course, that's the million-dollar question, and there's no single answers, but I think there's a lot of answers, and some of them are here. We are needing to perpetually be working on ourselves and seeking guidance for our own health issues, physical and emotional, or cognitive if you have them. And we need to cultivate the proper posture of a loving, accepting, patient, encouraging posture toward our patients and toward one another and toward this work. And I always love to say we need to take ourselves seriously, and we also need to not take ourselves too seriously. It's a little bit of an edge on either side there. You don't want to be so serious that you're sort of boring, and you don't want to be not serious enough where you're not taken as the professional that you are. So there's many ways and many things that we can do to get ourselves there. One of the things that I speak about a lot with my students is the concept of creating routines in a lot of different areas, certainly in taking an excellent patient history, certainly in being able to do an appropriate and relevant physical exam. But in addition to those two that are obvious and talked about quite a bit in naturopathic school, I think another area that we can develop routines and lean on our routine and lean on our doing the same thing over and again is honing our observational skills when we're with our patients. And then another one in that category for me would be being able to predictably, reliably, and quickly clear your mind between your patients. You know, a lot of times very complicated and sometimes sad, sometimes overwhelming stories are shared in the therapeutic dynamic with your patients, and that patient's going to leave, and either right away or 5 minutes later you hopefully will have another patient. And what is it that you can do to help you clear your mind between your patients? Another area that I'm very interested in is encouraging naturopathic medical students and naturopathic providers to process their feelings along the day and intermittently or periodically over the course of weeks and months as well, so that they can have some assessment of how things are going, they can process some of the feelings that come up, and they can look for help and support if need be. So we work to have these skills become routine in both creating a therapeutic plan and in committing to relevant and consistent continuing education. This quote is one that I often share with my peeps. I don't know, many of you are probably too young to remember Greg Louganis. He was an Olympic gold medal diver for the American team. It's a beautiful photograph of him there. And he wrote, "I'm a real perfectionist, but that's the irony. In order to do it perfectly, I have to let go of perfection a little. For instance, in diving, there's a sweet spot on the board right at the end. I can't always hit it perfectly. Sometimes I'm a little back from it, sometimes a little over. But the judges can't tell that. I have to deal with whatever takeoff I've been given. I can't leave my mind on the board. I have to stay in the present. I have to relax enough to clue into the memory tape of how I do it. That's why I train so hard, not to do it right, but to do it right from all the wrong places." So why I love this quote, and feel free to share it with other people, is because we all have a lot of wrong places that we can arrive to, either the classroom setting, a patient-doctor interview, whatever it is that we're doing, teaching, writing, performing, on the athletic field, whatever your interests might be. Maybe you're hungry, maybe you're tired, maybe you haven't gotten enough exercise in weeks, maybe you haven't slept well, maybe your relationship is not in a good place, maybe you're worried about student loans, maybe you don't feel well, you're dealing with your own health issues. And of course, for many of us, the weight of the world could be on our shoulders, or maybe you're burned out. I've spoken a lot about the topic of burnout and resilience for physicians at a number of conferences over the last few years. There are all kinds of wrong places. So what do we need to do? We need to have routines that enable us to get in the proper mindset. And a lot of people who have experience with athletics will call this or use the term getting in the zone. I think it's the exact same terminology is appropriate for the doctor and the doctor-patient relationship. And part of getting into the zone is by leaning on and relying on the routines that we have established, and by practicing them over and over again and refining them. It's not that you come up with something when you are a recent graduate and it's, you're 28 years old and you do that for the next 30 or 40 years. You adapt, you change, you shift based on your own needs, based on your own experiences and new things that you learn, or things you realize, that's not working for me. I'm going to do something different. I've got to try something different. And I do think it's also similar to playing a musical instrument or being really good at a sport, or personally, myself, my husband and I are very avid ballroom dancers. And I can tell you that the first several years of learning ballroom dance, it was all about looking at my feet, making sure they were going in the right direction, and making sure my arms were held at the exact right height. And now that I'm several years into it and have all of the basic skills, I can really get much more into the creative aspects. And this is the same with medicine. So once your routines are established and you have some comfort with what you're doing and how you're doing it and how it's going, then you can really start to fly, and you can really be creative both in your case taking and case analysis with your patients and with your working up plans for them. But the practice and the routine and the skills, they have to be there first. And that's really where the art of naturopathic medicine comes forth. Once you have those things established, then you can really get into the rhythm of it and get into your own rhythm of it. It's such a pleasure. And people say to me, what do how can you describe your work and what do you think of your work? I say, it's a pleasure. It's a pleasure for me to sit down with a new patient or to sit down with a family group that I've been treating for decades. It's a pleasure to be able to have a pleasure and an honor to have the opportunity to help people when they might be having a hard time, or when they have physical body challenges, or when they are down in the dumps emotionally. That's the joy and the pleasure of being a naturopathic doctor. So the idea of a clinical routine is also essential. It's just what I was speaking about a moment ago. Some of our improvisation is based on our patient needs, and some of it is based on the information that you need. So I talk about establishing your routine. Of course, hand washing between patients is number one. That has to be sort of the first thing on everybody's list. I encourage people to try to find something that clears your mind. Try to find something that opens your heart. I personally do some breathing techniques myself between patients. If it's a particularly stressful either patient or perhaps a morning full of patients, I will maybe do a few yoga postures in one of the back rooms in my clinic. And of course, we have to each be addressing our physical needs as they arise. I think sitting, most of us sit quite a bit in a doctor role. We can get out of that a little bit if we're doing something like acupuncture, certainly any of the hands-on kind of approaches, manipulation, Bowen technique and things like that, that some naturopathic doctors like to include in their practice. But for many people, there's a lot of sitting around. So I think getting up and taking a lap around the office, around the building, maybe taking a walk at the lunch hour, if you're taking a lunch hour, which I hope you are, things that will really help to enhance your own health and your circulation, and getting yourself moving gets the circulation to the brain, helps you think better. Yes, and then of course, as I mentioned already, being able to change your routine as you deem necessary, but you have to start with something. So don't forget to start with something, really, in anything that you're doing in this life, whether it's being a student, being a doctor, or wherever else life might bring you. And then how is it that we are able to stay in the zone and have easy access to getting into the zone as I've described? I think one of the most important things is to take time away from this work and to create your own healthy life, and allow that you have a clear understanding and articulation of your own values and goals, so that those inform your priorities. And of course, that's going to be different for everybody. For some people, that's going to be their relationship. Some people, it's going to be family, exercise, community service, teaching, practice. There's so many different kinds of values and goals to have, and that's such a personal thing. But it's important to note them and to keep circling back around and being sure that you can create clear paths to your priorities. I think the worst thing is to not have any clear goals and values, to not create your list of priorities, and then to just meander through your career. I don't think that would be really quite as satisfying in a general sort of way. And then, of course, we are always, I think everybody should be, if not already, working on creating and cultivating an attitude and a posture of appreciation and gratitude for whatever it is in your life that you appreciate and you're grateful for. I think that reminding, and I spend a lot of time with patients talking about this as well. I think that it's easy to focus on the negative, or focus on the things that aren't going well, or focus on the things that are challenging or troubling, and even just being reminded, oh yes, maybe we should be thinking about the things we're happy about, the things that we're glad for, the things that we feel blessed about, if that's your vernacular. So that's something that I talk about with my colleagues. That's something that I talk about with my patients. It's something I talk about with my students. I think it's an important point to remember. So the first job with every new patient is to connect. I think, whether that's in the waiting room when you go back out to greet them, or if you're greeting them in the room, to really be sure that you're not in a distracted sort of state, to connect with the patient, and if it's a child, the patient's a child, to really work to connect first with the parent. The child will take the parent's lead. So focus on the parent in that situation. And of course, we want to have plenty of time to take a complete history and do a relevant review of system, do a relevant physical exam. You only have one time, we say this in every field out there, you only have one time to make a first good impression. So you want to stack your first visits with your patients with all of your abilities, all of your people skills that you can muster. And I always recommend that you should not necessarily jump right into what the chief complaint or the main reason for the visit is. Learn a little bit about their life and their interests. And in my office, we have an intake form. The patient has generally written down what their chief complaint is, just as a way to sort of tack down the visit. So let's say they wrote, rheumatoid arthritis and migraines, or typical sort of complaints people come to naturopathic doctors for. And I could just start right in, tell me about your headaches or tell me about your joints. But instead I say, I see that you want to work on rheumatoid arthritis and the issue with migraines. We're definitely going to get to that. Before we start, just give me a little rundown about your life. Tell me about your work, tell me about your family. Now, of course, that's a big can of worms, and that could go on for an hour, but it's not going to go on for an hour. You're going to help to curtail it. But instead of jumping right into the chief complaint, you want to get a sense of who this person is and what makes them tick and what their life is about. I think it's a much easier way of connecting around the physical problems because you now have a little bit of sense of the person. My father-in-law is a barber, and he, bless his heart, is still working at 90 years old, and he works 6 days a week, a half a day on Sunday. So very dedicated and ambitious barber. And he, early on in our career, gave us the advice, have to do it a lot like in a barber shop. In a barber shop, when the person first sits down in the chair, you chat him up, you go kind of slowly, you are very mindful of, everything in a slow, routine kind of way. And then you snip, 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 do your haircut, do your shave, whatever's going to be happening for that person in the barbershop analogy, and then you end it slowly. You wrap it up at the end slowly with another question about the family. You tack it down to something very concrete, and you end in a non-rushed fashion. I think that's a beautiful analogy. It's one that I come back to often in my own work with patients. I think it's important if a patient is coming in with a problem that you are not familiar with, either it's an uncommon kind of problem, and believe me, those are often the patients that wind up at the naturopathic doctor's offices. Do your homework ahead of time. Read up on what the diagnosis is so that you are at least somewhat informed. I have found that a lot of parents of children that have orphan diseases or very unusual complaints, they themselves are experts, and you certainly can rely on them. But do enough background information, background study, so that you at least know what you're going to be working with that day. Of course, we need to clear the previous patients from our mind and our own worries and concerns about our own lives, and being clear to set the agenda with the patient at the first visit. I think it's very helpful for everybody to know where you are and what you're thinking. You need to schedule more time with that patient if there's too many things on the agenda. Don't try to shoehorn everything into that first visit. You won't do as good of a job as you could, and I think everybody will feel stressed. And then we also need to contextualize the patient's response to their illness and their suffering. Sometimes you have a patient who has a tiny little thing and they're absolutely crazy because of it. And other times people have a major, major illness and they just seem to be, gliding through life without much concern. And so why this is important is that we want to aim our therapies appropriately. We don't want to overtreat people, and we don't want to undertreat people. So I'll give you an example. I had a gal once call me at home very early in the morning before my clinical day began, hysterical. She was suffering from what she called life-threatening poison ivy. Now, I don't know about you, in the Northeast, poison ivy can be quite bad, and I have seen some very, very bad cases with bullous kind of blistering over large portions of the body, lots and lots of inflammation. I have seen bad poison ivy. And I said, okay, no problem. I'll come in early. Just meet me at the clinic and I'll be there. And when we got there, she had what I could only describe as two little dots of poison ivy. It was almost imperceptible. And so for me, it became very clear that what she was mostly suffering from was anxiety and overwhelm. She had other things going on in her life at that moment in time unrelated to the poison ivy. And this just was sort of the straw that broke the camel's back. But it was very important. Like, I was not going to bring full guns of naturopathic medicine, and we have a lot of things to offer somebody really suffering with poison ivy, but she was not a candidate for them. Instead, we worked more on the psycho-emotional things and did a little bit for the poison ivy. So it's just important to be able to understand, make sure that you understand where a person is with their with their issues and with their problems that they're coming to you for. And, part of that is just when a patient feels heard and the patient feels understood, they're really much more likely to listen to recommendations. And that's an area, the whole concept of compliance. How do we get our patients to do what we know to be good things? You can come up with a beautiful plan for a patient, but if they don't do it, or they're not willing to do it, or they're not able to do it, well, that doesn't really help anybody. So, um, there's a psychologist who some know, Carl Rogers, who suggests we aim for 3 things in our patient encounters. The first one is being authentic and allowing the patient to experience you in your authentic state. To accept your patients even if you don't agree with some of his or her actions. And to show understanding by being respectful of the patient's choices and the patient's experiences. Sometimes we have conflict. Sometimes during a visit there's conflict. Maybe there's been a misunderstanding. Maybe there has been a miscommunication. And we basically can't ignore conflict. Ignoring conflict never works. We just either lose that patient to follow-up or they leave disgruntled, even worse, so or both. So I'm a big fan of working to name conflict, to own it, asking for the opportunity to start over, and going back to something I mentioned earlier, confirming that we have the same agenda for our time together and working to resolve whatever the conflict might have been. And also reminding my students and my patients that, you really don't have to treat every patient that comes to you. There are graceful and legal ways to deny service, and that's something that occasionally, not often, we don't do. Well, I think we'll just move along from here. I do want to touch upon remembering the power of touch. Many patients, at least in my practice, in my experience over the last 30 years, are touch-starved, especially if they're not in a loving primary relationship, or maybe they've never had children, no little ones around. Those of us who have raised kids, some of us feel overtouched when the kids are little. It's a little bit like, oh my God, I just need a break. But for many patients, I do try to include some form of appropriate touch, whether that's a little bit of massage, whether that's during my physical exam, whether that's a technique called release by positioning. And many naturopathic doctors have a toolkit full of things that they would do in the physical realm: naturopathic manipulation, acupuncture. And of course, with this particular comment, we always want to have cultural sensitivity. It would not be appropriate in some cultures. You have to know that. And of course, we want everybody to, for me, I want my students, when they're working with patients, to explain everything that they're doing as they're going along, so that the patient is not surprised by anything and that the patient feels comfortable at all times. I think remembering the power of laughter. Yes, I try to bring some levity into my doctor-patient relationships. I will make fun of myself sometimes, or share fun stories from my life that are relevant. I'm not necessarily sharing canned jokes. That would certainly not be my area of expertise, but there are funny things sometimes to share, and it does help to lighten the mood and relax people if there's a little bit of humor in the doctor-patient visit. It helps create rapport, it alleviates anxiety, it promotes healing. The last point here, if you sense that your patient does not have a sense of humor, don't go there, because it's just going to fall like a lead balloon, as we say. The concept of essential empathy, I mean, we really want to be explicit with our empathy. The patients are not going to know that we've understood them unless we say so. So this in turn allows their stories to better unfold, and your understanding of the patient improves and evolves over time. And sometimes I don't get a really clear, full understanding of my patient until several visits in. Some people hold their cards a little closer to their chest, and some people are more expressive and ebullient, and of course that's fine, but it's just important for us to be sure we're being empathetic. And part of that is, first of all, I think it saves us from the monotony of cold and unfeeling visits with patients. That's important to prevent burnout. But it also and ultimately allows the patient to feel safer and to feel more cared for and to feel more comfortable with you, which will enable you to further and better help them because you will better be able to understand what it is that's bothering them and how they experience it. So that's important. We can talk about how to end the very first visit. I like to aim low and aim long. I like to set up realistic expectations and I like to write them down. That way, when we have a follow-up visit some months later, some weeks later, depending on the nature of the chief complaint, we all know what we're looking for. We don't want it to be a vague kind of, you should feel better overall. We want to tack that down. And I think it helps us all immeasurably. It's sort of like another chapter of setting the agenda. As a naturopathic physician, I'm often asking for, requesting of the patient for some unbiased sources of information at the time of the follow-up, whether that's laboratory work or information from teachers, if it's a troubled child, who has ADHD. Let's get some feedback from the teacher. So it's not just from the patient and not just from the parent. Try to keep very good charts. And of course, that's a legal requirement, but it also makes the follow-up that much easier. I keep a separate chart of things I need to do for particular patients between visits, and of course, I really work hard to do them all in a timely fashion. And I try to end my first visit on as light a note as possible. I don't want to send the person out in a heavy downer state. So how do we inspire our patients? How do we get buy-in so that our patients will do the things we're asking them to do? Naturopathic doctors are so interested in preventive medicine. We are so interested in diet. We're interested in lifestyle improvement through exercise, through relaxation techniques. And some of these things require change. They require patients making a change. And change for a lot of people does not come easily. About making better food choices, about getting consistent, better or more appropriate exercise, about really taking on the stress in their lives to lower it. Are there any things in their life that they can actually stop doing or get rid of because they're just not working for them? Or else, what are the things that they can do that help to raise their threshold for feeling the stress in the first place? So these are things that take time and effort, and it's not a slam dunk. You have to be able to, as a doctor, inspire people to make the changes you want them to make. Some of that, you have to understand the way that person functions and what's going to move them. If I have somebody who's very organized and very methodical and comes in with a lot of folders and everything's alphabetical and they're 10 minutes early and they're all tucked in, like that's a person I know I can load up with lots of research information. Here's the data. They're going to respond to the data. If I have another person who comes in sort of a little bit out of it, not able to focus, a little ADD, data is not going to really work for them. I got to take a different tact with that person. So for people in general, I would say offer reasonable plans, simplify, don't make things too complicated. Don't try to change everything at once. Get some of the low-hanging fruit to start, get some of the big-ticket items that are going to have more bang for the buck. Small, incremental, and permanent changes are way better than radical ones. Rarely does the person who makes the radical changes, rarely are they able to stick with it. So I always go for the small, incremental changes that can be permanent and can be enduring. I have never found fear to be a great motivator. I think other doctors maybe use fear a little bit. That's never been a big tool in my toolkit. Most patients want something that's fun, that has a little bit of fun to it. It's a little bit interesting, doable. It's not uncommon for me, for instance, to get on the internet while I'm sitting with the patient after I've established my connection and rapport with them. Let's say they're a middle-aged person who hasn't exercised ever. I'm going to get on the internet, look up their town or something nearby, and look up something that might be interesting, throw them out some interesting possible options. Maybe you want to take a fencing class. Maybe you have something in your neighborhood related to square dancing. Maybe there's something that you can do. You can go bicycling with a group of people. And I find that getting, and particularly for people who are a little older and not as computer savvy, a young person might be able to just get online and find those kind of things. But an older or less computer savvy person, I do some of that legwork for them. People love it. They love it. They feel like, oh, she really cares about me. She's really going the extra yard to help me find something that might be interesting for me. So yeah, do go for the low-hanging fruit, because when patients feel a little bit better, they see a few results on a lab or on the scale or on the amount of pain and discomfort they're experiencing. That's the best motivator for them. People who come back and they're feeling a little better, they will be much more motivated to make changes that you have recommended, or further changes that you might recommend. So between visits, I want to be sure that I've done everything that I said I would do. I like to sometimes send a postcard or email, a follow-up to patients, just thanking them for their time and for sharing their story. I need to do research on some patients, so that's part of my off-hours work. Sometimes I need to contact another provider to ask questions or touch base about our mutual patient. That could be another naturopathic doctor, could be a medical doctor, an osteopath in our area, chiropractor. I might need to order something for that patient, and of course I may need to review past medical records that have come with the patient. We have the thrill of helping people in this profession, and we have the stress of falling short. I really like to emphasize the role of humility. Anytime there's a success, I like to pass that success off and right back to the patient and the healing power of nature and their efforts. I'm always looking for ways to improve my skills to help the patients that I'm not helping. And I have worked very hard in my career never to give up on a patient. Some patients who don't help, they have illnesses that nobody's helping. But we can continue to try and be encouraging and look for small incremental improvement. And I like to cultivate an openness to feedback from my patients so that I can really work to improve my own skill set. Sometimes we have patients who are challenging for various reasons. It could be the kind of complaint they have. It could also be temperamental, personality, kind of negative people. They do exist. They are out there. They do find their way to every kind of office. And, you know, it's easy to be easy with the patients that don't challenge us. But the more challenging ones, we still have to be as generous as possible in terms of our posture toward them and our encouragement toward them and the time we take with them. In terms of creating time and space for reflection on our own work, I think that whatever works for you is important to do. But I do think having some emphasis on thinking about what you're doing, whether it's through writing or through conversations with colleagues or peers, I think is very helpful. It helps you kind of periodically sync your mind and your heart, which is a good thing to do. Finding mentors. Yes, I always throw that out there. I think mentors, I had them, and I think that they are a very key component to our evolution as doctors. So, those of you who are thinking about going to naturopathic school, those of you who are in naturopathic school, you really are the artists that are going to create the naturopathic medicine of the coming generations. And I welcome you with open arms. We just are so thrilled with anybody new that comes into the field and comes into the fold. It is like a nice, big, warm family. You have a serious charge, and you're going to be able to put your own stamp on our beautiful medicine. And it's an incredible profession, and we have so much to give the world, and it will at the same time give to you in so very many ways. So I am more than happy to take questions if there are any questions. This was the information that I have prepared.
Dr. Rothenberg, thank you so very much for your generosity of spirit in coming in and speaking to us. I will get a few questions your way. Just before I do, I wanted to let folks know about two upcoming events that we have scheduled. June 3rd is another webinar from a current student, Griffin McMath, Tales from the Trenches, Life of an ND Student, and AANMC will also be present at the Student Health Professions Fair on June 18th, which is at the Minneapolis Hilton. more information can be found at NAHP, which is the National Association for Advisors of the Health Professions. So if you are in the Midwest or able to be in Minneapolis on June 18th, we would love to see you there. And if you have any questions that we have not been able to address today, you can send those over to info@aanmc.org. So with that, I've got a couple questions for you, Dr. Rothenberg. So there were a few students here who had questions about the advantages of naturopathic medical school over, let's say, osteopathic school or another profession, and how you really, think about getting started in this path.
I think that there are many routes to healing, and I think that our world needs all kinds of doctors. I think that there is a special place for naturopathic physicians that fill a gap that is not being met in the conventional medical world, related to the kind of things that I spoke about today, a lifestyle emphasis on natural medicine approaches, emphasis on looking at the whole person and stimulating the body's ability to heal itself, and those kinds of things. I think that if somebody were trying to decide among the various medical professions and which one speaks most to them, because I think it's going to be different depending on the person. I think the very best way to determine that would be to get yourself a naturopathic doctor that you can sit in with for a few weeks or a few days in your hometown or in a community nearby, and do the same thing with the other professions that you might be interested in pursuing, because the only way to get a sense of it is to get a sense of it. And the other thing to do, I think, would be to spend time at the naturopathic schools. I know that the ANMC has been active in having prospective student days. Some of them are actually at the school, some of those are virtual. Correct me if I'm wrong, Dr. Yanez. And I think putting yourself in the communities that you're thinking about for yourself and seeing where you feel best. I think the future of naturopathic medicine is bright. I think the licensure efforts are moving along very well in terms of the additional states that we still need to get licenses in. I think the more naturopathic doctors we have, the more that will happen. I think there will be new naturopathic schools opening in the coming years in the new states that get licensed, so we're very much looking forward to that. So I think the future is bright, and if you're interested in it at all, you should definitely go spend some time with some naturopathic doctors and go spend some time at the schools.
Thank you. We have a few questions about mentors. Can you speak to how to find mentors? What makes a good mentor?
That's a great question. A lot of mentor-mentee relationships happen on the more organic side, I would say. It's somebody that your parent knows, a naturopathic doctor who lives over there, and they were friends with that person, and you call or email that doctor and simply ask. I'm looking for somebody to shadow for some months while I'm home on spring break or while I'm home in the summer, my summer break. I think that sometimes the doctor-patient relationship evolves into a mentor relationship. We have many naturopath students who were former patients of ours who have decided to go on to naturopathic school. Some of those people we have mentored. Some of our students we have mentored. I think, what do you want in a mentor? You want somebody that you really relate to and you really connect with. Not that you want to necessarily practice exactly like them or be exactly like them, but there's something in the way that they communicate, in the way that they are with their patients or with their students that it just speaks to you. And I think not every naturopathic doctor is going to want, is going to feel comfortable being a mentor, but I think a lot of us are, because many of us were mentored, and we know how very valuable that was for us in our own development and evolution as doctors.
Thank you so much. So can you speak a little bit to mental health and naturopathic medicine?
You bet. I'm all for it. in a phrase. Many patients come to us with the chief complaint of depression, or the chief complaint of anxiety, or the chief complaint of irritability. Many others come with the chief complaint, or it's sort of rolled into whatever else that has brought them in. Many people come in with a physical problem, but after 5 minutes of speaking to them, you realize, oh my God, this person's so anxious. They're so ramped up. They're so stressed out. They can't get a grip. They're overwhelmed. So we also have a lot of patients who come in for a chief complaint in the physical realm, but then you look at their intake form and they're taking Paxil, or they're taking Klonopin, or they're taking a little bit of clonazepam, or they're drinking alcohol, or they're using marijuana, they're self-medicating, or taking prescription drugs to address mental and emotional kinds of complaints. We now know that for many people with those kinds of very typical mental and emotional concerns, that brain chemistry is so important. And many of the naturopathic approaches we use can address brain chemistry. So that, coupled with regular exercise, that coupled with mindfulness meditation techniques, that coupled with a homeopathic remedy, there are so many different approaches we use to help people with their mental and emotional challenges. And then sort of tangentially connected to that would be people that have more cognitive issues, people that have ADD, ADHD. We have now people in our practice come to us at 30 years old who have been on Adderall for 20 years. And what does that look like, and what does that mean? And are there ways to help them maybe reduce or get off of the drugs because they're not enjoying the side effects and they want to not be dependent on those medications? So lots and lots for people in those realms in terms of what naturopathic medicine can offer them.
Thank you. Can you talk a little bit about your prep time in between patients? And we've got a bunch of questions here. I'm going to try and take just a few more.
Okay. My prep time between patients, I see patients 2 full days a week. I've done that most of my career. That's how I prevented burnout. I do a lot of teaching and writing, so the rest of my career is not with patient contact. So when I am in the clinic, I am seeing patients one after another, kind of rapid fire, and I do some basic breathing techniques between patients if I need it. Some patients I don't need it. Some patients are very delightful. It's kind of easy. It's a very basic sort of thing. I know exactly what I'm going to be doing with them. It's not that challenging. I'm using all of my experience and my years of practice to inform my plans for those people. It's not that it's just easy peasy, but it's not stressful and it's not intense. Those patients, I simply say goodbye. I wash my hands. I go out to greet my next patient. In a situation where it's more intense, there's just more overlapping diagnoses, emotional, psychological problems on top of physical problems,